Good morning. Today I'd like to talk about Piezo ICSI and comparing that to conventional ICSI in women undergoing their first IVF cycle. So this is based on a recent publication in PLOS One in August 2025, comparison of the clinical outcomes between conventional intracytoplasmic sperm injection or ICSI or Piezo ICSI in women undergoing their first cycle of in vitro fertilization. They're Korean authors. And here you can see from their adjacent publication an indication of conventional ICSI using a very pointed needle and considerable deformation to Piezo ICSI using a blunted needle and, in this image, similar deformation. Okay, so a spoiler alert, as always, I always like to start with where I'm going to finish, and in this particular paper, the study showed that normal fertilization rate, the survival of oocytes after ICSI, and blastocyst formation rates on day 5 were significantly higher in the Piezo ICSI group than in the conventional ICSI group. Developmental rest of zygotes was lower in the Piezo group, and also the number of embryos available for vitrification can be increased by implementing Piezo ICSI in your clinic. Piezo ICSI has the potential to improve the development of zygotes into blastocysts. Okay, so by way of welcome disclaimer, my name's James Danger. I have a PhD in embryology with more than 50 years experience. I'm not a medical person, and this information is not medical advice, but it may help you in knowing what questions to ask about your treatment with your doctor, and maybe to help in understanding the advice that you receive. If you would like to promote your company or clinic or product, you may like to use this page to do that. You can also support the clinic by subscribing, or go to my fund page and give me a donation, leave a comment, or press a like. Lots of things you can do to tell me how good you're enjoying this video. Okay, so what is Piezo ICSI? Piezo ICSI is a modified version of the traditional ICSI technique. In ICSI, everything was mostly manual with very sharp needles. But with Piezo ICSI, they utilize a small piezoelectric pulse to create ultra-fast, sub-micron forward momentum in specifically designed flat-tip micropipettes. This technique allows for precise penetration of the zona pellucida and the egg membrane without causing a significant deformation or damage to the egg. And you can see a website here where there's more information available to you. Another website describing Piezo in the US. At the core, Piezo ICSI is a piezoelectric technology which transforms electrical energy into precise mechanical movements. This innovation plays a vital role in microfluidics, enabling precise manipulation of minute volumes of liquids and gases. Such precision is crucial for advanced diagnostic therapy and medical procedures. In Piezo ICSI, a piezoelectric actuator drives a glass micropipette containing the sperm. This actuator generates high precision movements to penetrate the egg zona pellucida and oolemma without damaging its delicate structure. The pipette is then carefully guided to deposit the sperm into the egg cytoplasm, ensuring optimal placement for fertilization. Well, that's very good. There is a website which I found rather worthwhile looking at, and there's an excellent YouTube video for training manual that you may like to look at to follow this technique further. And I recommend it, even though they're not subsidizing this video. Okay, so let's look at the data. This was a group of around about just over 2,000 oocytes, half to conventional ICSI and half to Piezo ICSI. And basically the number of mature oocytes were roughly the same, although I have to admit there's a lot of immature oocytes in this group. But significantly, there were more eggs fertilized with the Piezo technique, 78% compared to 72% with the ICSI. Not a lot, but that's 5% over. That's a lot over a lot of cases. Even though this was not significantly different, there were fewer abnormally fertilized oocytes. That's 1 PNs or no PNs or 3 PNs in the conventional ICSI compared to the piezoelectric one. So that's not significant, but I wouldn't be surprised if in the bigger cases it might prove to demonstrate that ICSI is causing some of these abnormal fertilized oocytes. But what's also important, and the thrust of this paper, is that there are fewer eggs that degenerate as a result of the Piezo injection. Now, I have to say, in this group, the authors are reporting a 6% degeneration rate, which reduced down to 3%, which is significant. But in my hands, since doing ICSI since 1989, whatever, I have almost no degeneration of oocytes. So there is a technical aspect to these results. And in some way it gives you a clue that maybe the Piezo ICSI is better because it's minimizing the manual aspects of ICSI and operator variability. The second set of data looks at the embryology. Basically, they're reporting that the number of arrested embryos was not significantly different, 0.125, but it's down from 2.5% down to 1.2% of arrested embryos. Roughly the same number of blastocysts, and percent of embryos, 65% to 68%, reaching blastocysts. However, the number of blastocysts reaching the blastocyst stage on day 5 over the total number of embryos was significantly higher. That is, you had more blastocysts per embryo with the Piezo group. That tells you that the ICSI technique, theoretically, is impacting on the ability of the embryo to form a blastocyst. And also, if you look at all the blastocysts that you've recovered, more reached blastocyst stage on day 5 in the Piezo group than in the conventional one, 66% to 74%. There's roughly the same number of embryos available for vitrification, 0.027, but once again, it's 59% to 63%. So it's actually just all these incremental bits make a difference. So that was the paper. Basically, they're saying since the number of degenerated oocytes could be reduced in the patients with high number of oocytes retrieved, the implementation of Piezo ICSI could also reduce the number of degenerated oocytes with lower numbers of eggs retrieved. Just by being able to reduce the degeneration rate of oocytes after Piezo ICSI, it might be beneficial for patients with a small number of retrieved oocytes. They make a comment that Piezo ICSI might be worth trying in patients who have very poor outcomes of conventional ICSI in previous cycle. Now, just on that point, it's an interesting one. I've done another video comparing IVF and ICSI for low number of cases. And most people have reported that if you only have 1 or 2 or 3 oocytes, ICSI is probably a better outcome than ICSI because of the degeneration rate of ICSI compared to natural IVF. And this paper is suggesting that an alternative technique, instead of doing conventional ICSI, maybe to use Piezo ICSI rather than, and then you may find that the difference between IVF and Piezo ICSI disappears. So for clinicians who like to use ICSI for a few number of eggs, just to make sure they've tried the very best, but paying a price by having some eggs degenerating, they may well like to invest their clinic in developing the skills for Piezo ICSI. But looking at some other publications just to finish up, the first one I could find was 1999 from a Sato group in Japan, and they could also show that it had a lot better survival rate, 88 compared to 81%, a better fertilization rate, 79% compared to 66%, and a better pregnancy rate, 23% to 14%. Now, I have to make a comment here, these pregnancy rates are very low, but the Sato group for a long time have been doing almost natural cycle IVF, 1 egg at a time. So for one oocyte collected, or 1 or 2 oocytes collected, this is a significant improvement against conventional ICSI. And they make the point that in Piezo ICSI, the needle is not sharpened and has a flat tip. However, the deformation of the oocyte during insertion of the needle is restrained by the minute vibration of the Piezo needle, and the oolemma is punctured readily and secured by the Piezo pulse. And in 1999, they were arguing that it's a promising new technique for human ICSI that should improve the survival, fertilization, and pregnancy rates of ICSI, and this indeed what has happened. If you look at a paper in 2021 by Xander Foxy in Australia, they also concluded that the Piezo ICSI significantly increased fertilization rates, increased the number of embryos available for cryopreservation compared to standard ICSI. In their case, they showed the fertilization was high, 80% compared to 65%. The degeneration rate was down 4.4% from 8%, which to me is incredibly high. That tells you there's an operator error here, some operator impact there. Abnormal fertilization down from 7% to 2%, once again suggesting the ICSI technique itself may be partially responsible for all the abnormal fertilizations. And incidentally, there's been some publications recently suggesting a lot of abnormal fertilizations are in fact euploid, and it may well be that the abnormal fertilization is a technical issue, a technical product of ICSI, rather than some abnormal aspect of the fertilization. But I thought their last comment was interesting, is that this technique may be more valuable for women over 38, where oocyte quality is less, and therefore they may be more vulnerable for degeneration. So considering using Piezo ICSI for women over 38 may well produce that extra blastocyst you need for a better pregnancy rate. There was another publication in 2024, a sibling oocyte study, where this trial also supported the possibility that Piezo ICSI increases the fertilization rate, decreases the degeneration rate, and increases the blastocyst quality compared to conventional ICSI. However, it does not appear to influence the clinical pregnancy rate or live birth rate per transfer. And this is a common observation where you're trying to improve the technique. Most technologies will produce one or two good quality oocytes, and they will always produce the same pregnancy rate. But you may well find, if you focus on the cumulative pregnancy rate, that having that extra one or two embryos to freeze and use as a frozen transfer may well show these techniques have value. And the last paper I'd like to talk about is an interesting one. This is the first babies conceived with automated cytointoplasmic sperm injection in Reproductive Biomedicine Online in 23. There's been more since then. But this is the first publication they're talking about the robotic ICSI technique. And the important thing is down the bottom is where they say the automated intracytoplasmic sperm injection, ICSI robot, is a prototype device that automates sperm injection into oocytes. The robot was developed to automate critical steps of the ICSI technique, including the ICSI pipette motion control, zona pellucida, and oolemma perforation with the piezo pulses, and oocyte analysis using artificial intelligence and computer vision algorithms. So the key thing here is, from a robotic point of view, they're using a piezo pulse technique to do the insertion of the zona and the oolemma. It was a superior to any other manual form to do it. Okay, I'd just like to finish up by summarising that lower degeneration rates make this technique worthwhile of consideration for cases with few or only one oocyte. Traditionally, IVF is a better option, but clinics may like to explore Piezo ICSI if there's a lower risk of damaging the oocyte. Overall, it seems to generate less damage. That appears to demonstrate that this gives you better quality embryos. This in itself suggests that ICSI does damage the oocyte and the embryo, and there is possibly a 5% influence of the technique on outcome. It's also very operator dependent, where the Piezo ICSI will become less operator dependent. Okay, thank you. I understand IVF is a personal journey that involves the action of many techniques and people, and it helps to understand all aspects of that journey. I hope this information may be of value. And you may like to ask your clinic, do they do Piezo ICSI if you have low numbers of eggs? If you like this information, please tell others about the YouTube channel and subscribe. Thank you. See you in my next video.